years of our baby of Fatima University. So today we're gonna do a proper putting on and removing personal protective equipment or PPE, which is needed to correctly protect oneself according to risk assessment and correct procedure to be followed.
So in preparation, to begin, ensure you remove all your jewelry and personal items and ensure that your hair is tied back if it's applicable. Next step is perform a hand hygiene. First is apply the product into a cup hand. Rub hands together, rubbing palm to palm. Rub the back of each hand with interlaced finger. Then palm to palm with interlaced finger. Rotate the hand into a cup shape. And after that, rub thumbs rationally. Then last is rub tips of fingers and nail beds in each palm. Continue rubbing until hands are completely dry. That we are ready to put on the PPE, check the integrity of the equipment and do not use any damaged equipment. So put the gown and tie around the neck and around the waist and secure it around the back. Make sure all clothing is covered by the gown. The next is place the medical or surgical mask on. Ensure it is over your nose and mouth. Pinch the metal piece to ensure a tight fit. Try not to touch the mask once it is secured on your face. Is put on the eye protection or goggles, which can be placed over the mask with the top resting in the middle of your forehead. Finally, put on a pair of gloves. Ensure they are placed over the cuff of the gown and that no skin is exposed. So removing PPE, the first step is to remove gloves using the glove-to-glove and skin-to-skin technique. This is the most soiled item which needs to be removed first and discarded safely. The next is remove gown by undoing the ties and ensure the gown is pulled away from the body, ensuring there is no contamination of your clothes or the environment. On inside out and dispose of safely in the garbage or laundry hamper. Perform hand hygiene with alcohol-based hand rub for 20 to 30 seconds. After applying the product, rub hands together, rubbing palm to palm. Rub the back of each hand with interlaced finger, palm to palm with interlaced finger. Then rotate the hands into a cup shape. Then next is rub the thumb rationally. And last is rub the tips of fingers and nail beds in each palm. Continue rubbing until hands are completely dry. Next is remove the eye protection by leaning forward and pulling them away from your face, whether that is face shield or goggles. Remove the mask by pulling it from the rear and dispose of it in the disposal container or garbage. Ensure you are taking the mask off with the straps and avoid touching the mask.